So the valve in between the right atrium and the right ventricle is known as the tricuspid valve, or the right atrioventricular valve. That is the valve between the atrium and the ventricle on the right. And the valve on the left side of the heart, in between the left atrium and left ventricle, is known as the left atrioventricular valve, or the bicuspid valve. The bicuspid valve is also sometimes known as, it is also known as the mitral valve. So the mitral valve, mitral. So the mitral valve divides the left atrium and the left ventricle. So, oh, I forgot an A over here. There's an A. Okay. So the other valve are the semilunar valve. The semilunar valves are the openings in the ventricles that lead to the pulmonary trunk and the pulmonary arteries on the right ventricle. So this valve right over here is called the pulmonary semilunar valve. The other semilunar valve is hidden right behind here. The semilunar valve on the left side of the heart is known as the aortic semilunar valve. The aortic semilunar valve opens into the largest artery of the body right over here. It's called the aorta. Now the aorta can be divided into three branches: the ascending aorta. This over here is the aortic arch, and the region that falls down and divides further into smaller arteries is known as the descending aorta. Now, right over here you see tiny oval depression, and this is called fossa ovalis. Now, the fossa ovalis is the remnant of an opening in the fetal heart. So in the fetal heart, this is known as foramen ovale, and the foramen ovale allows blood in the fetal heart to directly pass from the right atrium to the left atrium. So the whole pulmonary circuit is bypassed in the fetal heart. Now, within seconds after birth, a flap known as a septum primum, it shuts close the foramen ovale, and then in adults, it forms fossa ovalis. So one very common form of pathology of the heart is patent foramen ovale, which occurs when the primum does not shut close at birth and the fossa ovalis is unable to fuse. Okay, so about 20 to 25% of the general population may have this defect, but most have been benign and asymptomatic versions of these defects. Now, although it's very common, there are no known risk factors to this not closing right at birth. In non-life-threatening cases, it's just better to monitor the opening than to risk the surgery at birth itself. Now, we have talked about pulmonary circulation when we looked at pulmonary artery. So pulmonary circulation is a circulation of blood from the right side of the heart to the lungs. So this blood that is pumped to the lungs is highly deoxygenated. So the blue blood vessels carry deoxygenated blood, and that's why the pulmonary trunk and the pulmonary arteries are highlighted in blue. So the blood is pumped from the right side to the lungs, and the oxygen-rich blood returns from the lungs via the pulmonary veins. Now keep in mind, although we call this pulmonary veins, they are highlighted in red color because the lungs exchange gases and the blood returning to the heart is oxygen-rich. Now, the pulmonary arteries are another exception, wherein the arteries are highlighted in blue because these arteries carry oxygen-poor blood to the lungs. So the best definition of an artery is that arteries carry blood away from the heart and veins carry blood towards the heart. Now, systemic circulation is pumping of blood, which is oxygen-rich, from the left side of the heart through the aorta. So the aorta is the largest artery, and the blood is carried from the left ventricle through the aorta into different systemic arteries and all over the rest of the body. So obviously, since blood needs to be pumped under a lot higher pressure by the left heart, the walls of the left ventricle are really thick to withstand the pressure. Now, the oxygen-poor blood returns via the superior and inferior vena cava into the right atrium. So systemic circulation is basically pumping oxygen-rich blood from the heart to different body systems, and the return of oxygen-poor blood into the heart through the inferior and superior vena cava into the right atrium. So this picture over here shows the pulmonary circuit and the systemic circuit. The pulmonary circuit involves pumping blood to the lungs. Right over here, that's the right ventricle. It's the pumping chamber. Blood is pumped from the right ventricle through the pulmonary trunk, and the pulmonary trunk divides into left and right pulmonary arteries, and the pulmonary arteries carry blood to the left and right lungs respectively. Now, after gas exchange, the blood becomes oxygenated. Now you see the returning blood, the blood vessels in red. So the blood re-enters the heart from the lung via the left and right pulmonary veins. So the blood is first brought into the left atrium. Keep in mind the atrium is the receiving chamber. So no matter where the blood comes back from into the heart, it's always going to enter the atrium first. Now, from the left atrium, it enters the left ventricle. This valve right over here is called the bicuspid or the mitral valve. And from the left ventricle, when the heart contracts, the blood is forced through the aorta under really high pressure to different body systems. So now you see blood is entering the systemic circuit. So the oxygenated blood is pumped to the body systems, and so oxygen-poor blood, again, when it leaves the organ system, it returns back into the heart. The superior vena cava drains blood from the upper extremities, and the inferior vena cava drains blood from the lower extremities. And again, the blood enters back into the heart, it's brought back into the right atrium. From the right atrium, so this valve over here, which is the tricuspid valve, it opens and lets blood into the right ventricle. From the right ventricle, it's again pumped to the lungs through the pulmonary arteries, and the circle goes on. Okay, so the heart valves are known as AV valves and semilunar valves. The AV valves are open during relaxation. So when the heart is relaxed, blood passively flows and fills all four chambers. But when the heart is contracted, these AV valves between the atrium and the ventricle, they shut close. The other valve are the semilunar valve. They are closed during relaxation to prevent flow into the body system and the lungs, and during a ventricular contraction they are open, and again you can see that they behave in an opposite manner. The AV valves are closed during contraction, but the semilunar valve are open during contraction. So the opening and closing of the valve is determined in response to the pressure of the blood that is being pumped by the heart. Okay. So these cords over here, these are known as chordae tendineae. Now, chordae tendineae prevent the backflow of blood from the ventricles back into the atria. So if you look back at the interior view of the heart, you see these white structure known as chordae tendineae. They're present right by the atrioventricular valves. So this is the atrioventricular valve, and these are chordae tendineae. Now the chordae tendineae are tendinous, or also known as tendinous cords. They prevent the backflow of blood from the ventricles into the atrium. So when the heart contracts, the tendinous cord tighten and they shut close the AV valves to prevent backflow of blood. So if you look at the operation of valves, now blood enters the right atrium through the superior and inferior vena cava. Now these two vena cava do not have any valves. They open up into the right atrium, and as the ventricles passively fill up during relaxation, the AV valves are open, and when the atria contract, they squeeze additional blood into the ventricles. So at this point, the AV valves are open due to atrial pressure. So the atrium is squeezing blood into the ventricle at this point. Now, when the ventricles contract, the AV valves shut close and it prevents backflow of blood into the atrium. So the pressure of the blood being forced forces blood into the pulmonary trunk, and blood is taken into the left and right lungs, and it is at the same time the left ventricles contract and blood is forced through the aorta into the different body systems. Okay, so the next picture shows the operation of semilunar valves. The semilunar valves open up when the ventricles contract and the pressure in the atrium rises, and the blood is pushed up the semilunar valve into the pulmonary trunk and the aorta. So when the ventricles contract, the tendinous cords pull on the AV valves and they shut the AV valves close. So keep in mind the AV valve, or the atrioventricular valve on the right, is called the tricuspid valve because it has 3 cusps, and the AV valve on the left is called the bicuspid valve or the mitral valve. So when these heart valves do not function properly, they can cause prolapse or backflow of the blood into the previous chamber the valve opens it into. So the valvular disorders are often called carditis, meaning inflammation of the heart. Myocarditis means inflammation of the myocardium. One of the common triggers for this inflammation is Streptococcus pyogenes, which is a bacteria which leads to rheumatic fever or scarlet fever in presence of strep, which is a bacteria. And it's normally a disease of the childhood. Now, the most common valvular defect is the defect of the mitral valve on the left, which is also known as the bicuspid valve. So when the bicuspid valve does not close properly, it leads to a prolapse of the blood back from the ventricle into the left atrium. So this is called mitral valve prolapse. Now, stenosis is another condition of the heart where the heart becomes rigid, the valves become rigid and calcify over time. This causes loss of flexibility and normal function of the heart because the valves that are calcified are unable to close properly, and eventually it weakens the heart. Now, aortic stenosis is the stenosis of the aortic semilunar valve, and it affects a lot of people, about 2% of the population over 65 years of age. And as people age, the chordae tendineae, which are these cords that hold the valve tightly closed, they may tear, or these finger-like projections known as papillary muscles to which the tendinous cords are attached may die off, which can lead to a heart attack, which we call myocardial infarction. Now, in this case, the patient's condition will deteriorate dramatically and medical intervention is required. So if you look at cardiac circulation, the heart chambers do not really nourish the myocardium. They have their own blood vessels we call coronary arteries and veins. So coronary arteries are the branches of blood vessels from the base of the aorta that supply blood to the heart muscles. So right at the end of the aorta, really tiny arteries branch off to form major coronary arteries, and then you have the coronary veins. Now the coronary veins drain the deoxygenated blood back into the right atrium. Now, a coronary sinus is a big vein on the posterior side of the heart. Now, all the little veins from the heart converge into the coronary sinus, which then lets in blood into the right atrium. So, blood empties into the right atrium via coronary sinus. And why is it right atrium? Because the right atrium is the one that receives deoxygenated blood from different body systems, including the heart. Okay, right over here you see the arteries of the coronary circulation in red, and everything in blue are the coronary veins. Now this is the anterior view of the heart, and if you observe the major coronary arteries over here, the coronary arteries supply blood to the myocardium and other components of the heart. And this coronary artery emerges right at the base of the aorta. And the left coronary artery distributes blood to the left side of the heart, and it begins as a circumflex artery. So the circumflex artery emerges right in the front, and it wraps around the heart and carries more blood towards the back. And it branches off into the left coronary artery in the coronary sulcus, which is a groove which is filled with fat. So the left coronary artery further divides into is named as the anterior interventricular artery. So the anterior interventricular artery is the artery in between the ventricles, and that's why we call it the anterior interventricular artery. So this particular artery supplies blood to the interventricular septum. This particular artery is also known as the left anterior descending artery, or known as the LAD, LAD. So this is the second major branch arising from the left coronary artery. So right over here you see several little branches of blood vessels. So these are called, anastomosis. And anastomosis is an area where vessels unite to form interconnections to allow circulation in a particular region. Okay. So On the right, you see the right coronary artery in the coronary sulcus. So the right coronary artery supplies blood to the right side of the heart, specifically the right atrium. And right along the margin of the heart, you see the right marginal artery. So this one over here is the marginal artery, which carries blood from the right coronary artery to the right edge of the heart. So when there is a blockage in the heart, it's not all of these blood vessels will carry blood all the time, but when there's a blockage in the heart, these branches that we call anastomosis, these tiny interconnections, they can open up to allow an alternative pathway for flow of blood. Now, when there is a blockage in the coronary artery, when there's 100% blockage in the coronary artery, it can cause death of the myocardial cells, which can lead to a heart attack or a myocardial infarction.